Okay, day 3. My blood pressure was still low. The doctor took out the third tube, and as I said in my last video, he just said 1, 2, 3 and pulled it. He did have me breathe out and hold it, but we didn't do that 3 times or anything. So I just was shocked that without warning he pulled it out. And I get it, pulled the band-aid off quick. My sister's a pediatric nurse and she has to give shots and she doesn't let the kids wait a minute, yeah, I got something to say, because she knows the longer she waits to do this shot, the more stressed out they're going to be. So she just does it. She just does it and gets it done. And so I knew the doctor, that's what he was doing. But I felt a little tricked. Like, like he pulled one over on me. Like, what a jerk to do that and hurt me and not know, I don't know, not give me warning. I just felt like it wasn't cool. So after that third tube came out, I felt a whole lot better. They were still giving me medicine to bring my blood pressure up a little bit. And I think they took me off oxygen that day because I don't see that I wrote in the notes when the oxygen came off, but I think that was why. And my oxygen was 100%, so I was good. Day 4 after surgery, I'll put with this video. I slept a full night. They told me they took all the tubes out. On this 4th day, they took the catheter out. They left the pacemaker wires in until I was discharged because that's, I guess, the emergency. If they got to fix something, they just hook something up to those wires. So the PIC line or whatever was taken out of my neck. And they put a new IV line in my wrist. So now that I had all these things off me, I was ready to get out of ICU. The problem was there were no beds open in ICU. So they ended up keeping me in ICU for like 2 more days because of it. They were giving me stool softeners and Miralax, which is a powder. And you mix it. It has no flavor, so you don't have to worry about it being gross. My mom uses it, and so I knew what it was, and I knew it wasn't going to be gross. And I asked for cranberry juice, and I put it in, and the nurse handed it to me to drink. She poured it in, and you could see the grains of the Miralax powder in it. But I knew from my mom doing this that you got to wait for it to dissolve, or else you're going to feel the texture grit, and that might gross you out. So I just kept stirring it, waited for it to clear and be dissolved. It doesn't add any thickness. I just don't want to feel those grains in my mouth, It's like if you were drinking salt water and the salt wasn't diluted, or sugar and it wasn't diluted, it would be grainy like that, and that's not pleasurable. So let me see. I actually didn't have, and again, I'm sorry if this is too much information, but I'm telling it like it is because I want to help you. I actually, I can't believe I'm going to say this. In my world, in real life, I don't have normal daily bowel movements. I go once a week, sometimes twice a week. And I do have irritable bowel syndrome, and my gastroenterologist isn't concerned about my schedule. He said because it's normal for me. That's how I've always been. That's when I go. I don't get sick from it, so that's my normal. So it bothered me that the day after surgery they're trying to fill me with laxatives because laxatives make your stomach hurt. I got this gurgling going on. It's not making me poop. It's just making me uncomfortable and in pain. And they kept saying, "Oh, well, you can't leave till you poop, so you got to poop." Your nausea might be because you're so backed up. Oh, because they did X-ray every morning. They did an X-ray, I guess, to see how much fluid was still in you, maybe, or to see, I don't know what they were looking for. The lungs, I don't know. But every morning they did an X-ray, and the first X-ray they did, they said that I was very backed up. I appeared very backed up. But then the nurse also said, if you're holding your stomach tense during an X-ray, that also, on the X-ray, it looks like your bowels are full. even if they're empty, if you're holding your muscles tense, it looks like you got full bowels. So that might have been it. I might not have been backed up at all. I didn't feel constipated, you know. So anyway, um, the stool softeners and laxatives, I knew, you know, I just didn't want to get like a horrible diarrhea attack from these laxatives. I don't mind taking the stool softener, but, you know, I don't want to be on the toilet in pain when I'm trying to recover from heart surgery. You know what I mean? So, sorry this is wiggling. I'm on my laptop. I'm trying to hold the screen still. Um, they also said it's normal. Some people don't have a bowel movement because of the anesthesia that was in their system, that sometimes it's up to a week before people go, you know, just because you had the anesthesia. Um, they wanted to give me prune juice, and I know it tastes horrible. I never had it. I just hear everybody, you know, say it tastes horrible. My grandma used to drink it though, so I was thinking it couldn't be that bad, you know. Um, and it wasn't going to hurt me to drink it. I knew it was healthy for me, so I just made myself, like the days I wasn't hungry because I was nauseous or I didn't feel like I had an appetite, I forced myself to eat because I knew I needed the nourishment. So I just said, well, I'll plug my nose and drink it, you know, and it was not good. And the texture of it, you know how you eat a pear and the pear, or like applesauce, how it has that grit texture? That's what the prune juice has. But I'm going to tell you a secret. A different nurse that served me prune juice heated it up in the microwave, and it was delicious. It tasted like apple cider, and it thinned the consistency of it. So it was like I was drinking apple cider. And she actually put a laxative in it that tastes really sweet. So maybe that sweetened the flavor too. But you could even put a packet of sugar in there. Or for some reason, they had me on a diabetic diet the first couple days. You're on a restricted diet. I don't have diabetes, but they put everyone on this diet for some reason, the diabetic diet. So they give you non-sugar sweeteners or something. If you put that in the prune juice, it's going to make it taste a lot better. But I heat it up, you know. And if it's something you're worried about, if you think it's really going to gross you out, pick some up at the grocery store, heat it up, try it out at home, so you know what to expect. And it's not that bad. You're not going to die because it's not chocolate milk, you know. But it's much better heated up. Um, my blood pressure was 90 over 58. And they said because it's consistently low, it might just be that that's my new normal blood pressure. Um, so they stopped the blood pressure meds to raise it. And they said as long as I'm not dizzy or having symptoms, they said it's okay being that low. Um, I had a patient in the room next to me take a fall. He thought he felt good, and I guess he'd been getting up and using the toilet alone, because I was too at the end, toward the end of ICU. But what happened with him, he didn't get dizzy or pass out and fall. He tripped up on all these wires and leads that were around him, and he took a bad fall. So even if you feel like you can get up and you're not dizzy, it's not just about being dizzy or weak. You're wrapped in wires. Don't try to move around that room with these wires. The nurses want to help you. They're glad that you're calling them. You're not a nuisance. They don't want you to fall. So use the call bell, you know. And you could even tell the nurse, can you just hold the wires? I want to try to walk on my own, but I just don't want to trip on these wires. Um, my scar started itching. I still hadn't seen it. It was under a bandage, and my husband that was staying with me, he had to sleep in the parking garage because they wouldn't let him stay in the hotel with me or in the hospital with me. They had old nurses' quarters with beds that they said he could stay in as long as they weren't full, and they were full. So he was there, and he was like, "Oh my God," he said, "Your bone is sticking out." I'm like, "What?" And it was covered, so we couldn't see what it was, but um And I'll show you what this looks like. But, oh, that's from the PICC line. That one's from the PICC line. This is the top of the scar. And I want to try to show you a side view so you can see how much this thing is sticking out. Let's see. I don't think I'm going to be able to... I don't know if I'll be able to get a good picture of it. Okay, do you see it sticking out up here? All this. It's sticking out really far. It's, I don't know how well it's showing up on the camera, but it's like I have a ravioli under my skin. It's puffed out that far. And so he's like, oh my God, is that your bone? Why is it sticking out now? Is it going to stay like that? And so I asked the nurse, why is this sticking out here? Is that okay? And she said, yes, everyone gets that. It's the top of where they start cutting. So because it's the beginning of the incision, for some reason, that's the part that swells up the most. It has the most inflammation. And she said, don't worry, it'll go down. And someone in the forums that I'm in some heart surgery forums and pages, and one girl said, yeah, that, you know, I had that same thing and I was scared it wasn't going to go away. And she said, I'm 9 weeks post-op and it's completely gone. So I'm looking forward to that being gone. What other notes did I have for day? This was day 4. My plumbing still wasn't functioning. I had more prune juice. Oh, my heart rate when I was walking around, doing my walks with the nurse, my breathing was rapid and my heart rate was rapid. It was too rapid and it was setting off the alarm. So then they knew, okay, this isn't just a blood pressure issue. Something's going on. So they drew blood and the next morning they told me that my hemoglobin was low, that it was only 8.0. And I was like, what's hemoglobin? What do you mean? And she said, well, sometimes you lose some blood during surgery, and before surgery, your hemoglobin count was a 12.8, which is normal, and now it's only 8. So I guess during surgery I must have lost blood, but they didn't think it was enough blood to give me blood or something. I don't know. So she said, you know, we're gonna give you a unit. And I'm like, what do you mean give me a unit? Like, what's a unit? A unit of what? Blood. We're gonna give you a blood transfusion. I got scared to death. And I said, why do I need this? I said, doesn't your body, when you donate blood, your body makes blood for you? Like, it regenerates and makes more blood? And she said, yeah, but it takes, weeks and weeks for you to get up to the count where it should be. And I said, well, what's a safe count? And they said 9 would be good. If you're at 9, we wouldn't give you blood. And I said, well, and I said, okay, if that's what we got to do. And then I started researching it. And the statistics are, and the nurse said, okay, so I started researching it, and they said you have a 0.05 chance of your blood donor of contracting hepatitis, any of the hepatitises, or HIV. And so I asked the nurse, don't they test the blood for that? Don't they test the donors before they're allowed to get blood? And she said they do. They screen them. But if they contract it days before they're donating, it's not going to show up yet. So I'm like, I don't like those odds. My heart got fixed. The last thing I want is HIV or hepatitis for the rest of my life and have to deal with the consequences of that. I said, what are the other alternatives? Can I just stay in bed and let my heart heal and have it redo the blood? And I said, is it dangerously low, and is it going to affect my organs, or will I die if I don't do the transfusion? And so the nurse said she was going to have the physician come in and talk to me. And it was actually my surgeon that came in. And he said no. He said, my hemoglobin's 8.0. It's not dangerously low right now. He said, if we gave you a unit of blood, you'd perk right up and you wouldn't feel tired, and your hemoglobin would go up. And my mother-in-law, my ex-mother-in-law, told me that when her husband received blood, even though he received blood, it took a week before the hemoglobin raises in the blood still. So it's not going to be an instant fix anyway. So the surgeon said, we'll check your blood again tomorrow, and as long as it's not getting worse, if your hemoglobin's going up slowly, and as long as you're not having dizziness or fainting or feeling weak or lightheaded, um, and as long, yeah, that was it. And so he said, he's like, I'm going to support you if you don't want the transfusion. It's your own choice. And I said, if I need to do it, if it's a matter of life and death, if it's going to hurt my organs, like I just got my heart fixed. I don't want to hurt it by not receiving blood. So I said, if you think I need it to survive, I'll do it, you know. And he's like, no, as long as your hemoglobin's going up. So sure enough, the next day they drew blood, and my hemoglobin, instead of going down, it was up to a 8.2. So he knew it was on its way back up. So he said, you just got to be honest with us and tell us if you're feeling lightheaded or dizzy, because that means your brain isn't getting the oxygen from your blood. So, you know, your organs aren't getting their oxygen. So you have to tell us honestly if that's happening. And I said, yeah, absolutely, I would. So no blood transfusion. And I'm just looking at my phone to see if I had any more notes for day 4. My temperature got up to 99.4. It's always in the like 96, instead of 98.6, I have a low body temperature. It's usually 96.8. So my temp was 99.4. So to me, to my body, that's 6, 7, 8. That's like 3 points, almost 3 points higher. So if your temp is 98.6, it would be like 101.6 for you. So for me, I was feeling feverish and chills, and I was like, and it's like they didn't care. They're like, oh, we're not worried unless it gets up to 101, you know. And I tried to explain that it's usually low, so this is high for me, and they didn't care, you know. Like they have that guideline of 101, and so that's that. Then they took it during the night, and it had gone back down to 96.7 or something. Okay, so that's it for days 3 and 4. I'm going to stop this video and start the video for day 5 post-op.